Hello, I'm Dr. David Weitz, an optometrist here at the Eye Care Center. And over my 15-year career, I've slowly developed a keen interest in an eye disease that affects 75 million people yearly in this country. This disease I speak of is dry eye disease. Dry eye is a multifactorial disease of the tears and the ocular surface that results in symptoms of discomfort, visual disturbance, and tear film instability, with potential damage to the ocular surface. It is accompanied by increased osmolarity of the tear film and inflammation of the ocular surface. In this day and age, just labeling someone with dry eye leaves a very large window of uncertainty as to how much this disease affects a person and how to proceed in treatment if not given a more accurate diagnosis of the type and severity of their dry eye. When patients come to our office for a dry eye disease evaluation, we first ask them to complete a questionnaire that analyzes symptoms, lifestyle, and work environment so that we may see what kind of impact dry eye disease is having upon their daily life. Next, we evaluate visual acuity. Blurred vision is the earliest and most common symptom found in dry eye patients. It is not uncommon for patients to mention that the visual acuity chart is blurred or appears as though someone is looking through a film over the eye. But with forced blinking, the chart clears. This is quite indicative of evaporative dry eye. The next step is an exciting technology we have recently begun to use called Tear Lab. It is a unique tear-on-chip in-office lab technology which measures the actual salt content of the tear film. A number is produced that can quantify a person's tear film makeup. The higher the number, the more the salt in the tear film, which indicates a low water portion of the tear film. This number is invaluable to the doctor as it aids in assessing the success or progress of treatment in those who respond slowly to their dry eye therapy. Our next step is a test that measures the tear volume of the eye. This test is called a Chirmer Test. The Chirmer series of tests are quite simple yet provide good information. Basically, a thin strip of calibrated tissue-like paper, known as Chirmer strip, is hung off the bottom eyelid. The Chirmer strip sits in place with the eye closed for 5 minutes, and the strip is read in millimeters of absorption. As expected, the higher the number, the larger the tear volume. Once the Chirmer test and tear lab have been completed, we begin the use of diagnostic dyes placed in the eye to assess damage to the surface of the eye. The more damage, obviously the more severe the dry eye. Next, and possibly the most important step, is microscopic examination of the meibomian glands and the eyelids. If you suffer from dry eye disease, I ask that you visit your local eye care center doctor today and take advantage of our latest and greatest treatments and medications.